This is officially being dubbed the Hampden County Med Disposal System. Very proud to partner with Sheriff Mike Ash and the Hampden Sheriff's Department, along with all the local police forces who are represented here and many others who couldn't attend. It's a very proud moment for us as we continue to fight the opiate epidemic at all angles. And this is a very important aspect of what we intend to do. This is another great example of the sheriff's and my participation and cooperation with local and regional law enforcement. And we're coming together here collaboratively to fight on the front lines against opiate abuse and addiction. We're working together on this new initiative to responsibly discard medications from our bathroom cabinets and kitchen cupboards to ensure that they do not fall into the hands of those for whom they are not intended, and thereby preventing misuse and preventing addiction. We all know, and it's been reported many times, that 80%, 4 out of 5, users of heroin first started with prescription medication before using those illicit narcotics. It is clear prescription drugs are fueling this epidemic, and therefore this effort is being led by my office, the Hampden District Attorney's Office, the Hampden County Sheriff's Department, and the local police departments across the county to ensure that we get these prescription drugs that are unwanted and unused away from those who will misuse them, away from young people who might be at the precipice of starting an addiction problem. So we're really getting in front of addiction with this effort. I do want to thank local law enforcement for always thinking outside the box, for always thinking innovatively, for being progressive in the work that they do both on the streets and with preventative efforts like this, as well as joining us in this important effort. Without the leadership of our chiefs of police, some of whom are here today standing behind me, this would not be possible. It was very important on the model of this system to make sure that these were accessible to the public 24 hours a day, 7 days a week, and most importantly, in locked, secure facilities over which there is supervision and control by the police department. So really, being in police departments was the only and the perfect place to have these medicine return boxes. I also need to thank and again express my admiration for Sheriff Ash. Without him and his department, this would absolutely not be possible. The Sheriff's Department is integral and indisposable in this effort. They are actually going to be going around to these many police departments, collecting these drugs periodically and at the demand, at the request of the police departments when these boxes fill up. So we have a complete control and complete security by law enforcement throughout the process. So when these drugs are dropped off by citizens of Hampden County, they're supervised by our police departments in police departments themselves, and then they're picked up by members of the Sheriff's Department in a controlled environment and then taken to Covanta, which is in Agawam, which is a company that will environmentally responsibly dispose of these drugs and get them out of the wrong hands and not into our water streams and into our trash systems where they can do damage to our environment, which is something, of course, we're all very concerned with. I want to thank Covanta of Springfield for assisting in this very important effort as well. The med return boxes, we're calling them the med disposal boxes, have been provided by my office. It's through a partnership with the City of Springfield Health and Human Services, and specifically Marie Graves, who's here, and her efforts, as well as the Massachusetts Department of Public Health. We were able to bring in these boxes that you see standing here beside me in the hallway. There will be 14 locations throughout the county, 12 police stations and 2 corrections facilities run by Sheriff Ash. The Hampden County Sheriff's Department, as I mentioned, will collect these medications when called by police departments. The medications will be taken to Covanta for incineration that is responsible and environmentally mindful. The scourge of addiction knows no boundaries. As I talked about, we are working as law enforcement collaboratively in this county at all angles to prevent addiction from spreading and to reduce addiction as it exists now. This is what we can do to make sure that medicine cabinets and kitchen cupboards don't become the breeding grounds for addiction in our houses. Unwittingly, homeowners who keep these kinds of drugs for long periods of time are often falling into the wrong hands, and this is a way to get them away from the people who will misuse them. We in law enforcement will continue, however, to arrest and aggressively prosecute those who are looking to profit from addiction. We are working on both sides of this. Those who are out on our streets poisoning our communities, poisoning our streets and our children with drugs. I promise you, from the perspective of the district attorney and law enforcement in general, we will continue to work on that front but we're working as aggressively as possible as well to prevent addiction from taking place. We are treating addiction for what it is, a disease, and this is one more tool that can be used by our residents to ensure these medications don't fall into the wrong hands and cause further suffering. It's an important message that I want to deliver to the public, that we encourage residents to use these medicine disposal boxes. They will be in 12 police departments and 2 correction facilities, essentially covering the entire county. So as of a very short period of time from now, they will be available, of course, free of charge in police departments and correction facilities for residents to use to get rid of those unwanted unused prescription medications and other things that are in their medicine cabinets and kitchen cupboards. So please, let's make use of these. It's a great resource. Again, the utmost gratitude to Sheriff Mike Ash and his department for their partnership in this and many other efforts. The sheriff, of course, has led the charge on addiction for many, many years in this county and beyond, and I appreciate everything he's done for me and he does for the residents of Hampden County. Also thank all the police departments who are here, others who are not here, for their continued partnership in this effort and many others. I'm honored, again, to partner with the sheriff, and I introduce Sheriff Mike Ash for some words about this effort. Thank you.
No, thank you, DA, and again, thank you for your leadership. And very, very proud to, again, join with our police chiefs in a, if you will, a seamless, unified way. This is another example of the wonderful team we've got. Again, just to acknowledge your leadership, Anthony. We're all here because you've taken the initiative, made this happen. So we're really too happy, all of us, to support you in this effort and so on. I want to thank my staff, and as we know, I have a transportation team. They're out every day. You know, this is not any new expense, any extra expense, if you will, any overtime or anything. This is all part of their work and so on. So they're, again, happy to join with the police departments in making this happen, because they're the ones providing the secure setting and so on, the police chiefs, and we're going by and just providing the pickup and so on. So again, I do want to say is that, again, when you think about our inmates, I always say 90% of them there because of substance abuse issues. And we have a 28-day program, and I really try to make it a point to attend all the graduations. And one of the things that happens at graduation, each of them is expected to stand up and talk about their, if you will, their addiction and how it all got started. And just as Anthony highlighted, is that 4 out of 5 obviously can say that they started right in their own homes, and obviously, if you will, utilizing unwanted medications that are there in the house and so on. I'm always amazed by that age of 12, 13-year-olds, that puberty age, and then as we know at 15 or 16, you start with the heroin and so on, it gets more powerful. So again, this is a great step forth. This is just one of the many initiatives that we have, and again, I'm very, very proud to, if you will, come together with my brother law enforcement people in terms of our whole law enforcement again. So thank you, Anthony.
Thank you.